The good doctor is in the house.
Hello, I'm Dr. Sean Murphy.
Not that good doctor, this one.
The doctor is in. Dr. Jennifer Ashton.
Dr. Jen Ashton joins us.
Dr. Jen Ashton is here.
Chief Health and Medical Correspondent, ABC News.
This is your wheelhouse.
Yeah.
OBGYN
That's right.
here.
She got her medical degree from Columbia University, College of Physicians and Surgeons. She's board certified OBGYN. She's specially trained in women's health and surgery, and her patients today trust and adore her.
Next time, you'll wear a helmet.
And they're not alone, because millions of Americans turn daily to Dr. Jen on ABC.
You have pointed out over and over again that if you get the flu shot and then still get the flu, it still helps.
Exactly, and whether it's 10% or 30% effective, it can help reduce the severity of symptoms and serious complications.
So what can you do?
Right, for right now, we have to be clear, still get vaccinated.
And we're back now with those important new guidelines on breast cancer screening.
When you talk about screening for breast cancer, mammogram is still the gold standard.
So let me introduce you to the newest member of the GMA family. Would you please welcome Gemma?
Robin, she's my new patient. Most people have heard of heart attacks, but the ones caused by a blockage of the artery. This is something different. The key is recognizing the symptoms and getting prompt treatment, because that can be life-saving. If you ask someone, are you depressed? They're not going to be offended by that. You're not making a social judgment. You're making a potentially life-saving observation. The good news is there are more treatment options than ever before when you talk about depression.
What is most frightening to me from a medical aspect is actually what everyone in this shelter has endured and what they're going to endure, and you can literally see that in their eyes.
No matter how big or small the issue, when it comes to health, we all want someone we can trust, someone we know cares.
This is an easy tweak. You know, we're trying to do one at each
I'm
month.
in.
Me too.
Okay, let's do it.
Dr. Jen, morning, evening, anytime, anywhere. She's on call for America.
Thank you, Dr. Jen Ashton.
bet.
Appreciate that, and I know people at home really appreciate it as well.
Dr. Jen, ABC News.
Dr. Jen, some love.
The good doctor is on call for you.
Ladies and gentlemen, please welcome to the stage Chief Medical Correspondent for ABC News and Good Morning America, Dr. Jennifer Ashton.
Hello, Dallas. And I have to sit in this chair because it looks so amazing. Okay, I sat in it. I might go back to sit in it. Thank you so much for such an incredibly warm welcome. You guys look amazing. And I have to tell you that video and dance was a very hard act to follow. Speaking with Kate and Alicia backstage, Kate actually had to give me this ring because I think they look so amazing, but to cheer me up. And I think that I heard a lot of crying. I think that is the appropriate response when you watch what we just watched. So we're going to move on, and we're going to hopefully bring it a little bit, more positive, more upbeat, so that we can all kind of dry off the tears and get motivated into some action. First, I want to tell you why it's so special for me to be here with you in Dallas. I have a couple of connections to Dallas in particular that go way, way back. So first of all, when I was in college in New York City, for some reason, and this is a while ago, I was obsessed with cowboy boots. I had 7 pairs, and I had no connection to the state of Texas, so it was a little odd in New York City, but I wore them proudly, and I'm seeing some incredible boots since I've been here in Dallas, and so I might need to get another pair. Second connection to Dallas, which the OBGYNs in the room, and I've met a couple, know full well, is that every single OBGYN in the United States to get board certified must come here to Dallas to do our oral boards exams. So I was here, I came, I saw, I conquered. Thank goodness I passed. And that was actually the last time I was in Dallas, which was 2006. And now, just so blessed to be at what I call the mothership for the American Heart Association, which is here in Dallas. You guys do it better than any city in the country, in my opinion, and this room speaks to that. So I want to thank you for everything you do. The other thing that I just want to share with you is that 3 of my favorite people are actually in this room right now with me. My son, Alex, can you just peek out so that people can see you? There he is. He's 20. I stole him from New York, where he's in college at Columbia, to come and be my handler. Heavy lifting, I know. Also, my good girlfriend, Mal Anderson, is back here at my table supporting me and the American Heart Association. Thank you, Mal. And then we heard she's in the room. To me, this is like the female Elvis, but Nancy Brown, the CEO of the American Heart Association. Nancy packs a lot of punch to that little body, as we all know, and it's just, I feel so honored that you're here today, Nancy. So I want to talk to you for a few minutes about not just heart disease, but women's health. And so I titled my talk, How to Put the U Back in Uterus. And listen, it is not easy to come up with PG-rated, GYN-esque humor, so it took me a long time to think of that one. I think the best place to start is my story, which, as some of you know in the room, heart disease and cardiology literally are in my blood. I have a parent who's a cardiologist, so I grew up sitting around the family table hearing terms like myocardial infarction, the medical term for heart attack. I would go and make rounds in the hospital when I was still writing with a crayon with my cardiologist parent, and really was inspired to go into medicine in part because I'm the daughter of a cardiologist. My other parent was a registered nurse, so I really got kind of a double whammy of medicine literally in my DNA. We had a lot of other doctors in the family that were like a little bit of our own HMO. So we have a plastic reconstructive surgeon. We had an anesthesiologist, general practitioner, and another OBGYN. And when I was in medical school, you know, we have to learn about everything. So head to toe, we go on these rotations. And for me, this picture really says it all. I loved being in the operating room. I liked the drama. I liked the immediacy of it. And I found that I really liked taking care of women. And my parent, who was a cardiologist, is really smart. And I'm kind of competitive, and I really didn't think that I could keep up with that parent. So I said, OBGYN it is. I want to take care of women. And literally, not a day has gone by that I have regretted that decision. I think it is the best specialty in medicine, because anyone that gets to see a woman through the course of her entire lifetime just has it made. But I never forgot, you know, my passion and my family upbringing for cardiology. So how ironic is it that years later, we now have what I consider to be kind of a blessing, which is a hybridization, if you will, between my specialty and my parents' specialty, and the reason we're all here, which is cardiology. As some of you may know, and I want you all to really ponder these statistics, 90% of women, so let's just round up and basically say all of us, if you have 2 X chromosomes, you have at least one risk factor for heart disease. So let me say that again. 90% of women have at least one risk factor for heart disease. We've heard some statistics about the 1 in 3, every 80 seconds a woman dies of heart disease, but yet when we look around the room or we look around the table, none of us thinks that applies to us, right? We always think, oh, not me. You must be talking about her or her. Now, who do 90% of women see on a regular basis as their medical provider? OBGYNs, right? That's the well-woman primary care portal of entry, if you will, for health and maintenance for most women over the course of their entire lifetime. But yet, you would think, oh, that's perfect. So you have women being seen throughout the various stages of their life, including the heavy hormonal stages, which are connected with risk for heart disease, which is pregnancy and menopause. This is perfect. They're seeing a doctor. they must be getting screened. They must be getting educated. They must be having these discussions with their doctors. Unfortunately, no. Big study done from the American Heart Association in the last year to year and a half found that it was the least likely topic to come up at the well woman visit. How can that be, right? I would like you to think about the last time you went to your gynecologist, and I hope the visit lasted more than 4.5 minutes, because that is something that we all are seeing. You know, you wait and plan maybe 100 times more time than you actually have with that doctor. And think and ask yourself if he or she asked you about heart disease risk factors. And I would just like to see a show of hands if someone did have those questions asked to them. We'll be positive, right? We won't say raise your hand if you didn't, because that would be probably the whole room. I see 1 hand. I see 2 hands. I see a few hands. I want to say less than a dozen. We need to do better than that. We need to do better. So one of my favorite sayings, and this applies for the dialogue between OBGYN and cardiology, is be careful when you point a finger at someone, because there are 3 pointing right back at you. So it's not okay for OBGYNs to say, well, this patient has heart disease. Cardiologist, you deal with it. That's not okay anymore. We're seeing those women from teenagers, hopefully, all the way up through their lifetime. We have to do better. And I'm so, so proud that finally ACOG and the American Heart Association have come together. They have crossed the aisle, so to speak, and they came out with a big, powerful recommendation in May of 2018 that I was proud to cover for Good Morning America, that actually said, guess what? We need to work together. Women need to expect that at their well woman visit, their gynecologist will ask them about risk factors and help them reduce those risk factors. And cardiologists, and you can be sure I lectured my parent on this, need to ask their patients about things that may have happened decades ago, because that increases the risk as well. And when we talk about OBGYN and something that may have happened decades ago, during pregnancy, let's say, I want to take this moment to make everyone in this room aware of another statistic that I find utterly unacceptable, which is that we now in the United States lead the developed world in maternal mortality rates, which means that more women die having a baby or immediately after pregnancy than in any other developed nation in the world. That is an abomination, it's a national embarrassment, and we need to start making noise about that. And the #1 cause of death amongst those women is heart disease. And I think, the bottom line, whether you're talking about maternal mortality and obstetric deaths or cardiovascular disease just primarily amongst women of all ages, is that, in my opinion, part of how you assess a country's or a nation's health care is how they prioritize women's health. And we can do a lot better. I think also, and I know that this is a big reason why we're all in this room, is education. And when you talk about OBGYN and risk factors, a couple of years ago, it became pretty common knowledge that there are certain OBGYN events that are the same thing as having high cholesterol. They're the same thing as having high blood pressure. And they're known now as risk factors for heart disease. This is not a sexy slide, but I do want you to take a look at it, because a lot of people are visual learners. I'm one of them. Women who have had their babies 20, 30, 40 years ago, maybe even more, if you had any of these pregnancy complications, so preeclampsia, high blood pressure in pregnancy, you had a placental abruption, you had gestational diabetes, or you had a low birth weight baby, these are considered failed stress tests now. You need to go into your internist or cardiologist and say, oh, by the way, yes, something's changed since the last time I saw you. And they're going to say, okay, tell me. And you're going to say, it has to do with when I was pregnant. And they're going to go, And I promise you, you may be educating that healthcare provider. In terms of gynecology, polycystic ovarian syndrome, metabolic syndrome, these could be hour-long discussions in and of themselves. And hormones, hormonal contraception, or hormone replacement therapy, I want to just spend 10 seconds on that because I know that a lot of women now are going to be sitting up a little straighter and say, uh-oh, should I not take it? Should I take it? This is not a one-size-fits-all issue. Yes, there is data that hormonal therapy given around menopause increases a woman's risk for cardiac events. It is not one-size-fits-all. And if you need to take hormones, do I have patients who safely take them? Absolutely. And I'm sure that my OBGYN colleagues in the room are shaking their heads yes. But it is not for every woman. So these are discussions that I encourage you to have with your gynecologist, have with your cardiologist, and if you're seeing primary care, family medicine, internist, bring this up with him or her as well, because they may not have seen our Good Morning America segment. They may not have seen the monster press releases that came out of ACOG and the American Heart Association on these issues. I think we're in a time right now where it's almost impossible to turn on the TV and not hear something about the Me Too movement, the Time's Up movement. And for me, what I love about being a physician and being in medicine is I can listen to the entertainment news, I can listen to the political news, I can listen to all of that, but I'm interested in medicine and I'm interested in health. So when I hear Time's Up about our issues of parity and women's rights and equality, I think through a medical lens. And I think that it's impossible to talk about women and heart disease without talking about the incredible gender inequality that has existed for decades, especially in the field of heart disease. It's staggering. About 75% of published peer-reviewed studies failed to break down their results based on gender. And as I think everyone in this room knows by now, it is not the same thing when you talk about heart disease in men and heart disease in women. So I think we need to take a lot more kind of time when we construct our studies and look at methodology and make sure that women are being studied as they should. There are gender differences in medicine, there is no question. And there have been also studies that we've reported on Good Morning America where if a woman walks into an emergency room saying she has chest pain, she is not treated the same way as a man walking into the emergency room saying that he has chest pain. Ponder that. So we all are taking all of these steps and efforts to educate and empower and inform. And let's say we've done a good job in telling women what the signs of a heart attack are. And let's say she gets herself to an emergency room. She does all the right things. But yet once she gets there, even female physicians, by the way, are less likely to take her symptoms seriously and associate them with a possible heart attack than if she were a man. Unacceptable. And by the way, you do see the same thing in obstetrics as well. So this is not a problem that's just specific for heart disease. If a pregnant woman walks into an emergency room complaining of pain, she is not treated as quickly as a man walking in saying that he has chest pain. And that's 2 lives at stake with that pregnant woman. So I say time's up because I really mean time is up. We need to fix this crisis in women's health, and heart disease is at the top of it, but we also need to remember that it's not just as simple as what goes on in the hospital or the research lab. All of us, we have a responsibility to improve our own health literacy, all of us. And I joke with my patients a lot and I say, I'll retire when I am satisfied with the state of health literacy amongst women. And from the looks of things, unfortunately, I will never be retiring because I don't care whether you have a college degree or a 7th grade education level, because everyone has a screen or a device, that access to information does not translate into better health literacy yet. I believe it can, I believe it will. I think everyone in this room is committed to that endpoint, but right now that's not the case because I hear it on a daily basis. We have to put ourselves first. How many of you, like I did, gasped in Alicia's video, and I mean, it was staggering, right? Where she said, what was the first thing that she said to her husband on the stretcher in the ambulance? "I'm sorry." I mean, I think every woman in the room would probably say the same thing, myself included. So that's going to be harder for us to fix, right? I believe women are hardwired to put themselves last. And I know that a couple of years ago, this saying about the airline oxygen mask was really kind of popular. It was really in vogue. Put your own mask on before you assist someone else. That's true. I think that's really true. And as a mom, and I don't care now whether I'm speaking to the moms or the dads in the room, the only thing that scares me about my own mortality is leaving my children without a mother. That's it. Because I would be dead, right? So, for me, it'll be over. But when you are responsible for other people's lives, you have to put that first, even if it means therefore putting yourself first. So I want to tell you a story about how I kind of had to do that, but also how I am just as guilty as everyone in this room who hasn't put themselves first. I was driving my daughter about, maybe 5 years ago, up the Massachusetts Turnpike in December for a hockey tournament. And by the way, I am thrilled that the Dallas Stars are represented and supporting this event. Thank you. Because I should have said that's the fourth favorite thing in the room for me is hockey. But I am a huge hockey mom. My daughter plays hockey at the national level and will be playing Division I hockey in college next year. So I spend pretty much my whole life either working to buy her a new hockey stick or driving her to a hockey rink. So about 4 or 5 years ago, we were driving up the Mass Turnpike, just me and my daughter, and it was maybe 8 o'clock at night. And ironically, my cardiologist parent happened to call me. And I started telling a story about a patient that I had seen that day who I had scheduled for a minor surgical procedure, and I actually had to cancel the procedure because she had a blood abnormality. So I was having like a medical locker room talk, if you will, with my cardiologist parent, driving at 75 miles an hour, and I started to have chest pain. So what did I do? Any guesses? Ignored it. Ignored, denied. Oh no, this is not a good time. I'm driving up to a rink. It's nighttime. I have a 15-year-old next to me who can't take the wheel herself. This is just not a convenient time for me to be having chest pain. So I thought, maybe it's anxiety. I've had an anxiety attack. Anyone in this room has had an anxiety attack? Almost everyone, right? It's not pleasant. I thought, gosh, usually I have my anxiety attacks when I'm at the hockey rink watching a game. This time I'm behind the wheel. I don't know, maybe it's anxiety. But I didn't feel particularly anxious. So a couple of minutes go by in the conversation, and I said to my parent, I'm kind of having some substernal chest pain. Oh, and a little shortness of breath. So my cardiologist parent said, well, I think it's pretty unlikely that you're having a heart attack, but ... I don't think you can take any chances. Of course, I knew that that's what they were going to say. So they said, next hospital, I would pull over and go in. So I informed my daughter, listen, we're going to have to take a little detour. Don't worry, you'll make the game tomorrow morning. But I'm sure it's nothing. I just want to go get checked out. So I pulled off at the nearest emergency room, parked, walked in, and just like Alicia, who apologized for her cardiac arrest, I walked into the triage desk and I swear on a stack of Bibles, whispered to the clerk, hi, sorry to bother you. I'm a doctor and I'm having some chest pain and shortness of breath, and the key words which I recommend that everyone use if you get to an emergency room, and I think I'm having a heart attack. Well, the bells and whistles, because that is something that even the nurses and doctors need to hear. So things got going. I was fine. It turned out to be some kind of esophagitis from a stomach virus that I had had a couple of days. And 4 hours later, we made it to the hockey hotel for the tournament. But in retrospect, I realized that I actually taught my daughter a life lesson, which is take those symptoms seriously. And as I've said on Good Morning America, it is better to be wrong than to be dead. So please remember that story. Don't deny and ignore like even the doctors do. And don't apologize for being sick or feeling sick. I think that we all deserve to be taken seriously. And just a little GYN humor. Public cervix announcement. And no, you're not overreacting. I think that we need to admit to ourselves when we're not feeling well and understand that as inconvenient as it may be to go to the hospital and get checked out, it would be way more inconvenient if you died. So to wrap up, what can we do? And this goes for men as well. Lifestyle, 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 yes, that is important. We've heard again and again, and I think it is so empowering, 80% of heart disease is preventable by attention to lifestyle and behavior. Know your numbers. The American Heart Association has this amazing simple 7, which is know your blood pressure, know your LDL bad cholesterol, know your weight, know your blood glucose, and then the other 3 things are behavioral. If you smoke, stop. Be active and exercise and eat a clean, nutritious diet. I'm gonna really, really bother Nancy Brown. I wanna add either the Great 8 or the Fine 9. I think we need to add a couple of other things to that list. Stress and sleep and mental health. Because there have been a plethora of associations and data that shows that if we are stressed, we are at greater risk for heart disease. That might not be cause and effect, but it's associated, and I'll take it. Poor sleep, increased risk of heart disease. Again, maybe association, not causation, but could be causation, by the way. And mental health, we know that people who are depressed are also at greater risk of heart disease. We have to destigmatize mental health in this country and start taking it as seriously as we take cancer and heart disease and treat it. If you have depression, if you have anxiety, you deserve to have that treated. There is no shame in that game. And if you had high blood pressure, you would treat it. I would like you to think of mental health the same way. And then nutrition. This is one of my green drinks from Hawaii in December. I went back to school a few years ago to Columbia and suffered through 3 years of getting a degree in nutrition. Why? Because doctors know pathetically 0 about nutrition. Thank you, it's true. It is true. And you deserve to talk about food and nutrition when you go for your checkup. Bad food is a big part of what makes us sick, and food can be our medicine. So think of this green drink and educate yourself. I think it's clear that a lot of what puts us at risk is genetics. We can't change who our parents are, although sometimes we may want to. A lot of it is behavior. We know that. We hear it over and over again. But yes, everyone, sometimes we need medication. And I actually think that the media has done a poor job of suggesting to the American public that it's all or none. I think we need to go right down the middle here and understand that you can still do all the right things to prevent or lower your risk for heart disease and still need medication. So the 4 questions that I tell everyone they should ask if a healthcare provider or your gynecologist or your cardiologist tells you you need a medication is the following. What are the risks of taking the medication? What are the risks of not taking the medication? What are the benefits of taking the medication? And what are the benefits of not taking the medication? 4 questions. If you forget them, tweet me and I'll tweet you back at DRJ Ashton. This is my opinion now. I think statins have been clearly shown to save lives. That's the cholesterol lowering medication. When I have a patient in my office who sometimes, by the way, is a nurse, sometimes maybe another physician, and I tell them, you know, your LDL is 170. It should be below 100. And if you have a family history of heart disease, it should be way below 100. You could eat carrot sticks from now until the cows come home, and that is not going to get you to a healthy number. So are we doing our patients a service or our country a service when we say it's all behavior? But you know what? If you do all the right things and you still are out of range, well, too bad for you. I've heard too much and I've read too much data about the life-saving benefits of statins. So I would encourage you, have that conversation with a cardiologist. People say, oh, I'm gonna get side effects. I called the author of the American Heart Association consensus statement that was just put out in advance of the clinical meeting in November. It was over 100 pages. I said, what do you cite as the risk of severe side effects with statins? You know what the answer was? Cardiologists can't answer. 1 in 1,000. I'll take that risk to save my life. So please, please have an open mind and remember those 4 questions. I just want to end by saying that I mentioned it repeatedly throughout the whole talk. One parent's a cardiologist, one parent's a nurse. Think in your mind as I said that, which parent did you think was the cardiologist and which did you think was the nurse? First of all, you're probably right. Okay, my father is the cardiologist, still practicing in New York City. My mother is now a retired registered nurse. But the reason I ask you that is because if that's how we jump to conclusions in our mind, when you just hear a word, that's how people jump to conclusions when a woman says, I'm having chest pain. They don't think heart attack, they don't think heart disease, and we need to start reframing what categories we put people into. So I want to thank you so much. I know I ran a little over. I don't usually get 20 minutes of nonstop talking. If you watch Good Morning America, I have maybe 90 seconds. But I just love being here so much with you guys. I can't tell you, when I hear the term everything's bigger in Texas, you guys proved it in this room, selling out this luncheon, not only with your big hearts, but with your deep pockets. And I want to tell you, your support, your time, your interest, your enthusiasm for not just the American Heart Association and Dallas Go Red, but heart disease in general is impressive, and I thank you for that.